Good afternoon, everyone. Thank you so much for joining us on today's webinar, Youth Justice in the COVID-19 Era. My name is Josh Rovner. I'm the Senior Advocacy Associate at the Sentencing Project in Washington, D.C. I'm joined by Gina Womack of the Families and Friends of Louisiana's Incarcerated Children, Val Slater of the Rise for Youth Coalition in Virginia, and Kristian Blackmon of the Campaign for Youth Justice, an advocate and organizer in St. Louis. We're all very happy you're here, and I'll be giving them sort of longer opportunities to introduce themselves after I'm done with my sort of formal portion of the presentation today. This has been such a difficult time for all of us. The coronavirus continues to threaten our lives and our communities, and certainly the youth justice system has not been immune from that. Something I want you to keep in mind, though, before the pandemic hit, about 800,000 kids a year were sent to youth courts, to family courts, juvenile courts. Quarter of them, about 200,000 kids, are detained every year, and 62,000 of them were committed to facilities. That's an enormous number, but I think that it's important for you to all realize that that's about half as big as the system was just about 10 years ago. There's a lot about youth justice that needs drastic reform. And part of the reason I'm so happy with the panelists that we have today is that their experience isn't just limited to COVID-19, today's topic, but many reforms that have happened over the years that led to those successes. I don't want to minimize the successes or exaggerate them, but certainly what has happened over the last 10, 20 years or so has minimized the impact of COVID-19. And it's been bad, but it might have been even worse. So I'm going to share my screen, turn off my camera, and start with the presentation. See how this goes. And thank you all for your patience. And there we go. So you see the names of our panelists on there. And I already mentioned who our guests are today. Now, I've been tracking COVID-19 in youth justice facilities since about March, and I have a pretty limited perspective, despite the fact that I'm looking at this every day. I'm very eager to hear from all of you using the Q&A in the bottom. You see that there's two options to submit questions. One of them is a chat box, and the other is Q&A. Submit them to the Q&A box. Very happy to facilitate a chat, but I and the other panelists won't be looking at that chat box until this is all over. As I said, it's a hard time for all of us. For any of you who've lost family members, friends, people that you care about, I think it would be lovely if you type their name into the chat box, not the Q&A, so that we can take a moment to remember their memories. As you do, let me turn to an overview of today's presentation. On the right-hand side of the screen, you see the report that we issued in October, Youth Justice Under the Coronavirus. Still available on the Sentencing Project's website, sentencingproject.org, and you can download a copy there. I'll start today updating the data of what's happened since and turn to the impact of what the virus means for youth and families who are fighting this in the youth justice system. I want to give some positive examples of what's happened around the country and recommendations that show that we can in fact fight this and make some positive reforms. This whole presentation is going to last about 10, 15 minutes, and then we'll move to the roundtable discussion with our guests. As I said, I'm going to start with the data. There are at least 2,339 incarcerated youth who've tested positive for COVID-19. That averages out to about 10 kids per day for the 8 months that I've been doing this work. But the data aren't revealed with that sort of consistency. I gathered the data from three key sources. First, and this was especially important early on, I was very reliant on advocates, often legal defenders, who shared information about youth in custody had tested positive. Those stories were eventually confirmed by government agencies or followed up by local media. And so that brings me to the second source of the information, local news sources. It's especially important for the county-run detention facilities because that's often local media will cover this as a local news story. And third, in about half of states, the data is made public, either on a website or relationships that I've built with public-facing government officials who share with me the number of kids or staff members who've tested positive. And that covers about half the states plus DC. So the most important thing I want you to understand as you look at this graph, which is daunting in its own right, is that it's really quite incomplete. I don't have access to all of the information that would make this graph complete. In fact, just yesterday, I received an email from Washington State's Department of Children, Youth, and Families informing me it would take 6 months to inform me of the number of youth in their facilities who tested positive. As I pestered them a little bit more, it may come a little faster, but that's sort of the instinct that the agencies might have. And that brings me to the two major limitations to these data. First, as with the rest of the country outside of these facilities, there is not adequate testing taking place. So we don't know the scope of the virus within facilities. Some states have taken steps to test all of the kids in their care. New Jersey was the first state to do this, and other states have followed. But without testing everyone, we can't possibly know how many youth or staff are positive. And second, even if testing does take place, the results only show up if they're reported somewhere. Now, I generally don't spend a lot of time on the distinction between public and private facilities, but I've generally found the public facilities have been much more forthcoming of what's happening in behind their walls. This graph shows the monthly totals, and you can see that July was by far the peak month so far. Now, I suspect that that's because a lot of the cases that were actually found in May and June weren't reported until July. I do the best that I can to date the diagnoses to the date that they happened, not the date they were reported, but it's pretty limited. But if we just focus on the 4 most recent months, August through yesterday's data, you can see that there were more cases in September than in August, more in October than September, and November is on pace to probably pass October as well. I post these updates every couple of days on my Twitter account. You see it in the bottom right-hand corner. I'm at Josh Rovner, R-O-V-N-E-R. On the left-hand side is the Sentencing Project's Twitter account, which I urge you to follow as well. Much more comprehensive than anything that I'm up to. Here are state-by-state totals for the states with at least 10 known cases among youth. And there's a few things I want you to understand before drawing any conclusions about this. I don't want to make any excuses for the states that are that show up worse on this graph, but understand that states like Texas and Florida have actually been somewhat transparent with their data. In Florida's case, that's been especially helpful because Florida is very reliant on privately managed youth justice facilities. And as a result of that, we have a much better sense of what's happening in private facilities nationally because of what Florida is willing to report. On the other hand, like Pennsylvania also relies on privately managed facilities quite a bit, but isn't reporting nearly as many. Now, on the other hand, in the next batch of states, you'll see Arizona. And Arizona hasn't revealed any of this information on its own, and I learned about it through media reports. Local reporting found 92 youth cases at the Mingus Mountain facility and 45 more at the Adobe Mountain School, which is managed by the state. And you won't find a word about either outbreak on the Arizona Department of Corrections website or Sequel Children and Family Services website, which manages Mingus Mountain. So I'm sympathetic to a state like Tennessee, which has a lot of cases, shows up relatively poorly on this map, and that's partly because its Department of Children and its Department of Children's Services has actually shared some data, not all of it, but about the total number of cases. Now, if a state shows up light gray on this map, I again don't draw any conclusions. You have Maine up in the Northeast, and Maine has tested every youth at the Long Creek Youth Development Center. That's 210 tests over about 6 months' time and found 1 case. On the other hand, Arkansas is another state that has fewer than 10 cases. And that is perhaps a result of the fact that they're not testing and not reporting, and certainly not compared to neighboring Missouri, which has a pretty good public-facing website. Please don't hesitate to email me personally about what may be happening in your state. You already have my email address from the invitation to this webinar. It's jrovner@sentencingproject.org, and I can follow up with you about what's happening in individual states. Now, we gotta turn to the impact of this, because a lot of the jerks that I deal with on Twitter will limit the story of COVID-19 to deaths. Did anyone die from their infection? And I'm thankful, relieved to report that the short answer to that question is no, that more than 2,300 kids have tested positive, and to my knowledge, none of them have died directly from the virus yet. On the other hand, 4 staff members working in these facilities have died. Now, there's a lot more to the impact than just life and death situations. We should be demanding more from these children's lives than mere survival. We all understand that slowing the virus demands keeping people apart from each other. But for youth, that distance has meant the end of visitation from their families and loved ones. Lawyers have had limited in-person contact as well. Ending visitation has stopped programming in many cases, as outside counselors or educators are not allowed in. We've learned of educational programs being replaced by photocopied piles of worksheets. And given how essential family connections are to youth, this is just a terrible development. All of these kids are going home eventually, and maintaining strong relationships with their families, with their communities, is absolutely vital. Understandably, the kids are afraid. Like the rest of us, they are all afraid, and they don't know what's happening next, and they're getting scant information. Rumors go viral, after all, as well. There have been significant staffing shortages because the virus has spread among staff members. The virus doesn't care what your clothes look like. It doesn't care how old you are. If you come in contact with it, the virus has a good chance of infecting you. And so along with the 2,300 youth who've tested positive, at least 3,300 facility members have also tested positive. And that has occasionally led to even more chaotic environments inside the facility walls. And lastly, we understand that people who test positive or have reason to believe they might be positive are told to isolate. Now, for people like myself, that would mean living in my basement for a couple of weeks to keep my wife and children safe. For an incarcerated child, being a room by oneself can feel like solitary confinement in all but name. I doubt many of them can distinguish a medical isolation from solitary confinement, one of the worst forms of punishment there is. So, what can be done? And moreover, what is being done? First, we need to place fewer kids in these facilities to prevent the virus from spreading. The most obvious way to limit the spread of COVID-19 is to have fewer incarcerated kids to begin with. Now, given the sharp drops in youth incarceration over this century, facilities are in fact less crowded than they used to be. And many of the largest facilities have either closed up or closed up wings, meaning that there are fewer kids inside. Here's one way to look at it. In the year 2000, there were more than 250 facilities that were over capacity. Over 250 facilities over capacity in the year 2000. As of 2018, there were 11 facilities over capacity. The number of large facilities, generally defined as a place with about 100 beds or more, dropped from 264 to 88. 264 to 68 large facilities. That's real progress, even as we push to get that number down to 0. Now, there's 2 parts to draining a bathtub. First, we have to shut off the incoming water, and we have indeed seen fewer admissions during the pandemic, as agents are reconsidering whether detention is the right response. Georgia's Clayton County, for example, limited admissions to youth charged with violent or gun felonies, and the detention population there fell from about 15 to fewer than 4 on most days. The District of Columbia said youth cannot be taken into custody unless they present a risk of harm to themselves or to others. Now, you may think that that's a pretty good policy that ought to be considered post-pandemic, and I would agree with you on that. Now, second, you also have to open the drain. And we have, in fact, seen agencies releasing youth who are near the conclusions of their sentences and trying to arrange for services for them at home. Governors in Michigan and Colorado issued executive orders to release more youth, and leaders in Georgia, Maryland, Massachusetts, and elsewhere have done the same, occasionally prodded by youth courts. Our next recommendations are for widespread testing and reporting. I mentioned earlier that Florida and Texas are high on the list of infections, partly due to widespread testing, but that's not inevitable. I found a few positive cases in large facilities in Nebraska, North Carolina, Rhode Island. Those facilities decided to test everyone after finding a couple of cases and only found a few more. Now, reporting is an essential part of this. And so I urge government agencies to report their negative results along with their positive ones. It provides comfort to the families to know that tests are coming up negative. And states like Indiana, Ohio, Tennessee post negative test results, as well as the positives. Let me add that this work that I personally have been doing fills a void left by the Trump administration's Office of Juvenile Justice and Delinquency Prevention. These data ought to be tracked by them or someone else with more resources than myself, and they ought to be more complete as a result of this. Now, mostly we need to listen to the experts, the American Academy of Pediatrics, Youth Corrections Leaders for Justice, an organization of current and former prosecutors called Fair and Just Prosecution, Physicians for Criminal Justice Reform. They've also done the same thing that the Sentencing Project and our guests today have called for, which is release of more youth and not admitting as many kids into the facilities. These are common sense steps, and they are in fact being taken. Now, let me stop sharing my screen. I'll turn my video on again, and I'll ask our panelists to do the same. And as we do that, what I'd like to do is have something of a roundtable discussion. Our panelists have a lot of experience here. And so on my screen, I have Gina, Val, and Kristian in order. So maybe for the first question, we'll answer that question in order. And I'm curious to hear from each of you, before the pandemic, how did each of you get involved in the youth justice movement?
So I guess that means me first. So again, I am Gina Womack. I am the executive director and a co-founder of Families and Friends of Louisiana's Incarcerated Children. Here in Louisiana, our office is based in New Orleans. And I came to this work over 22 years ago. So I was the office administrator for our parent organization called Juvenile Justice Project of Louisiana. And doing all of the duties that I had as well, I was answering the phones and heard from families who were calling because they were looking for services and treatment for their young people. They were referred to a state agency that is supposed to connect needy families with services called Families in Needs of Services. But that really was the conduit to the prison to pipeline. And so hearing from families and hearing of their struggles and their sadness, I asked to start a support group. And from starting a support group, we began to meet. Our families began to discuss what was going on and recognize that this wasn't that they were bad parents, that they didn't love their kids like the system likes to tell us, but rather they were families in need of supports and services, and there was none to be found. And so being able to talk to each other, built a support system that just gave the power just was reignited in the families because they were together. And so they decided they wanted to join this lawsuit that was happening with JJPL. And we began our leadership development, including myself. I'm a single mom of 3 children. And so although my children were young, I could clearly see us in this situation. And we decided we wanted to do something. And we began to fight. We began to build our voice, our leaders, and learn more about what was really happening and what we could really envision and dream of for our young people. And therefore, we organized ourselves about 19 years ago, we became FLIC, our own organization. And we then closed the country's worst, most notorious youth prison a couple of years later. So in 2003, we passed this holistic Juvenile Justice Reform Act, Act 1225, that would made promises to our young people and families, gave them reasons to, hope and dream again, and closed the Tallulah, the following year in 2004. We had almost 2,000 young people locked in state prisons. We also ended privatization for the juvenile system here in Louisiana. And our families have continued to organize. We are now multi-generational. We have young people that are included in the fight. And we are determined to ensure that this law that was put in place that we fought for would actually be realized. So a lot of our work now is around implementing full implementation, having seats at tables to make sure that there's an authentic parent and youth voice. So we continue, and this is how so I basically call it divine intervention, and which is why I also stayed, because it's a lot of hurdles to go through. Administrations change, promises are broken, but our young people are still being locked up. So that is my introduction to the youth justice system.
Thanks so much, Gina. Val, can I send it your way about your involvement pre-COVID?
Sure. So yes, again, my name is Valerie Slater. I am the director of Rise for Youth. Rise stands for Reinvest in Supportive Environments. And we believe first and foremost that prison is not a place for children. I'm really excited to lead the Rise Coalition. I was previously an attorney at the Disability Law Center of Virginia, where I advocated for the rights of children and the many different spaces where children with different learning abilities are wherever they are, whether it's in school, whether it's in their living environments, whether they were incarcerated. And so I had the opportunity to advocate for some of Virginia's most vulnerable children. And I realized that way too many of those children were in the juvenile justice system. And, it became one of the outliers, if you will. First would be color, and then you would look at disabilities, and then you would look at LGBTQ. But if you had a combination of any of those two or three, you were going to find the greatest number of children involved in the justice system. And so when Rise for Youth was formed, it was in response to nationally, Annie Casey and others, they did a study to look at juvenile justice across the nation. And overwhelmingly, we found, of course, that the adult prison model was what everything was pretty much modeled after, that we had forgotten in our nation that children are children and should not be treated as many adults when they find themselves in trouble. Virginia, of course, also began that transition process of looking at how can we do juvenile justice in a more holistic and a better way. And the task force that was formed by the department included advocates at its initial formation. As they wound down the task force and realized they had put together their plan, they kicked the advocates out of the room and said, hey, we've got this, we'll run with it. And so Rise for Youth was formed as a response. It was their way of saying, advocates and impacted and caring community members should still be a part of this work. And so Rise for Youth, when it formed, at its very first meeting, I was there as a representative of the Disability Law Center of Virginia, and signed on as an organization, but also became an individual member. And the coalition coordinator at the time was Jury Thomas, and when she transitioned to do something different, they invited me to apply for the job, and I applied, got the job as the coalition coordinator. We were a project of the Legal Aid Justice Center at the time, and then we eventually recognized it was time for us to kind of be an independent organization. So successfully took Rise for Youth Independent in 2018. So we have been standing up on our own now for just over 2 years, which is very exciting. And we continue to do this amazing work to just fight for children in every arena. Our name is Reinvest in Supportive Environments. And so while we know that prisons don't work, we also recognize that there are so many environments that need to be invested in, that have been divested or have never been invested in at all. And so the work of fighting for children, it is my life's purpose. And so I am grateful to be doing the work. And I'll tell you more about it as we go on in our conversation today, but that's how I got involved.
Thank you so much. Now, Kristian, I understand that you were involved in the Raise the Age campaigns in Missouri, and you want to talk about more of your background there?
Yeah, absolutely. So first off, thank you again for inviting me onto this panel. So I came into specifically with Youth Justice work, with Campaign for Youth Justice with Raise the Age. For those that know, Raise the Age is raising the age from 17 to 18. Before that though, I've done a lot of organizing and activism work in many different intersections. A lot of my work, when I first came in, a lot of it was around some political engagement, voting rights, economic justice, LGBTQ, and things like that. As far as youth justice, I've done a lot of volunteer work with other organizations, other advocacy groups that center youth. But for me, what I often find or found is that a lot of time youth voices aren't centered. So whatever is happening, a lot of the work that is happening, a lot of times youth aren't the center of that. And as it comes to this, as far as incarceration, and particularly with COVID, it seems as if there was a lot of conversations and work that was happening broadly across the country, but specifically here in our state, it was seeming as if it was a very small demographic of folks that were responding to the fact that youth are incarcerated right now and what is happening with the youth. So as I was working with Raise the Age, that quickly pivoted to responding to COVID and youth that had been in institutions. So when we found and was hearing about cases where youth, particularly the Hogan Street facility here, which is a state-run facility, we immediately responded. So Campaign for Youth Justice, and then Metropolitan Congregations United is another organization, faith-based-led organization here that does a lot of work with youth, particularly around school to prison pipeline work and things like that. So we collaborated to immediately respond to the fact that there had been a youth and a staff at this particular facility that contracted COVID. That was in like the end of March. So we actually did an in-person rally. I know we're going to speak a little bit around like how we had to pivot and maneuver with the pandemic as far as doing actions and how do we get community involved. But we did do an in-person action at the facility. And was just really the only demand was just we wanted these youth to be immediately released from this facility. Of course, there was a lot of pushback around that, a lot of lack of response from folks that were in positions of power to make that happen. But we continue to push as far as having folks contact those that were in positions of power, making sure community was educated that this was a thing, that youth were at risk and staff was at risk as well at this facility. By the time, within a couple months, so by the time June came, we then found out that almost half of the youth at this same facility had now contracted COVID, along with more staff as well. So by that point, we were a little bit more agitational and aggressive in how we responded to this and wanting to get the community to respond to it as well. And also because what we were finding is the lack of transparency between the facility and not just the community, but the parents and the loved ones of these youth, of what was happening to them in the facility itself. Because like we said, we saw that visitation and stuff had stopped with most of these facilities due to COVID. So parents and loved ones weren't able to be in the same type of contact with their kids in the same way. So we were seeing that there was a lot of lack of transparency. And in addition to saying release these youth, we also wanted the facilities to be able to be more transparent into what they were doing, what action steps they were taking with keeping youth safe. How are they responding and contacting families and loved ones? And then how are they also putting that information out to the community as well? So that was my quick kind of shift into doing this work specifically, which I hate that it's work that has to be a thing, but I'm super excited and happy that I've been placed to do this work right now, because again, before all of this, I went to school to become a teacher. I went to school for elementary education, so I've been a lover of children for a very long time. So to be able to do organizing and activism work around something like this specifically has been great. So yeah.
Yeah, you know, and Kristian, one of the things that struck me in the media coverage, and it was especially, I think it's the Black press in St. Louis. The St. Louis American is not the St. Louis Post-Dispatch, but so much more coverage there. And from what I understand of the kids who tested positive there, overwhelmingly African-American youth. I think the staff that was testing positive, overwhelmingly African-American. This virus is not hitting all communities equally. We already know that there's strong disparities throughout the juvenile justice system, throughout the criminal justice system. How well do you each feel that government leaders are listening to the families who are making the demands that Kristian talked about? Val, why don't you go first?
Sure. You know, great question. So we have had family members that, you know, they started reaching out to us because they were not getting responses from the department. And then we ended up putting together a support group for family members so that they could share the information that they were all hearing. And at the same time, we, Rise for Youth, we were able to gather the information that we needed to advocate more fully on behalf of families and young people. You know, it was really disheartening to even learn that more children than the one that was posted initially on DJJ's site here in Virginia. The only reason we found out initially that there was more than one was in a briefing from the governor. Secretary of Public Safety was speaking, and he said, "Oh, well, there's more than one." And I don't think he meant to say such a thing. And then it took a FOIA request being filed before DJJ began to release this information. And so, unfortunately, they weren't very responsive to family members. And then also trying to make sure that families weren't being charged child support while their children are incarcerated and during a pandemic when there's already so much stress. So all of these things are bombarding family members. They're not able to speak to their kids, or when they speak to their children, someone else is in the room jumping into the conversation, or, you know, all of these things were happening, and parents were just looking for a way to say, "Hey, please don't forget about my child." And so our clarion call became, don't forget about the children. Don't use the whole kids aren't dying from this or kids are immune to this. Stop using this rhetoric that you have absolutely no data to support. That's almost like, you know, well, we'll just say it until everyone believes it. And if it turns out to be different, well, you know, I guess we'll have to say sorry at the end. Well, we weren't willing to hear that. And so it literally took, you know, so much effort to get the department to begin to release data, to stop using solitary confinement as the way to quarantine children. And, you know, and for children to not even be told if someone that they were in close quarters with was infected with the virus, you know, and parents not being told, you know, kids would be tested if they came into close contact. And so if a parent said, "Hey, has my child, you know, have they received, have they been in close proximity to someone who has had the virus?" They would say, "Your child is being tested," but never admit that the child had been in close proximity to someone who is infected with the virus. I mean, we just played cloak and dagger, and it just didn't make sense. And so we just continue to push, continue to fight. And I'm not saying that they are incredibly transparent even now, because even though there are 34 cases that have been reported, according to DJJ, the last update was in August. And I guess, I don't know if they figure we just believe that from August to November 17th, there's just not been another case amongst children. But, you know, it's almost as if no one is pushing, they're not revealing, they're not being transparent. October 1st, they did begin on a trial basis in-person visitation as reported on their website. But I mean, I tell you what, it has not been a transparent process. No, parents haven't been listened to, children haven't been listened to. You know, just one more anecdotal story. We had a young man who, a family, and the young man in that family, he sent a letter that was so disturbing to his mother. And he was basically saying goodbye to her in case something happened to him and in case he was the one that caused that something negative to happen to himself. And then there was blood on the letter. And so you can just imagine how frantic this parent was. I cannot imagine receiving a letter from my child, which indicates he potentially might harm himself, knowing that he has mental health issues and that he is not receiving those therapies as he should. And then to not receive, you know, any kind of communication from the facility to demonstrate that you are taking this, what my child has said, seriously. So it has been a fight. We continue to fight. But, you know, to answer your question in the short, no, they haven't been very responsive, but we have continued to fight against that lack of response.
Yeah, you know, so we have a question that came in, and I sort of want to bounce it toward Gina. You can't answer this specific question, but someone asked, why isn't Arizona required to report this data? One of the few things that Louisiana had going for it is that your Office of Juvenile Justice was one of the early states to actually start reporting this. And there was every reason to think that there wasn't adequate testing taking place. But why is it, do you think, that we don't get better data, better answers from government agencies? Because I can't say Arizona, I'm here in my bedroom in Maryland, but why is it that the secrecy is so endemic to the system?
Yeah, why indeed, right? And I mean, and that's just basically how they've operated for many years. And I mean, we're talking about a system, and especially in Louisiana, like, you know, like we're at the bottom of the country in everything child related, right? So there is just such a awful lack of transparency. And it's not like folks don't hold them accountable, but you know, we all have, you know, limitations, right? And just because we had access to some information being reported on our website didn't make it accurate or adequate information, right? And so there was a long period of time, I can't remember the actual time lapse that happened, but more than a month where the numbers stayed the same. And we knew, we heard from parents and other folks that, you know, they weren't necessarily always testing the young people or the workers, right? A lot of things are happening inside of the facility, and they're not being really transparent. And the system, the way it is set up, it's not really set up to hold itself accountable, right? Which is why we have to exist. And, you know, and it's so frustrating, it's so exhausting, just like Val said. You know, we fight for laws to be changed and for accountability. However, to ensure those things happen, then rest on the shoulders of those that are most impacted. Like, we're expected to get the data, do the research, go to and explain stuff to our lawmakers who don't always get the holistic perspective, right? And then keep coming back and keep coming back while we're literally dying in the street every day, right? Like, COVID isn't the first crisis that we dealt with in Louisiana. We had Katrina, and it was just so frustrating because, like, we put things in place, mechanisms in place, and they're not followed. Like, I could write, and probably will write, a book on what is being unearthed on the bureaucracy that happens and the layers that you have to try to unearth to see, like, who's gonna hold this accountable? Where's the table that I need to go to that's making the decisions about my life and my, you know, my children's lives? And then what happens after that? So as I mentioned, like, we, back in 2003, we passed this Juvenile Justice Reform Act. And where I sit, like, the legislation was so comprehensive that it made sure it was about the defunding of these policing systems on our bodies way back when, right? And had we paid attention and put more money into services, we wouldn't have as many young people in the prison system. So, I mean, there's no short answer for the question that you asked. Yeah. It's just very convoluted and very complicated. Again, like we have so many tables that are created on top of tables. Lawmakers come, they go, they shift priorities. In the middle of the pandemic in Louisiana, we had, everything was happening. We were short-staffed in the beginning, right? Because it's so hard, because we don't want to pay the folks what they should get paid to get qualified workers to be in the system. So in the middle of everything that was happening, the secretary over the Office of Juvenile Justice resigned. They appointed an individual that did not have any experience working in the youth justice system, and things went from worse to worser, if that's a word to use. Many of the staffing was getting sick. It wasn't necessarily reported. Who was there to really watch over everything that was going on? They ended up hiring and putting probation officers in place. There was pepper spraying the kids, riots happened, and where was the accountability? Like if the system actually held itself accountable the way it does our children and our families, we might could get some work done. However, that does not happen. Again, all the onus is put on the people who are impacted, your most vulnerable population, to continue to hold the system accountable. And we're continuing to fight. We've been fighting to get seats at decision-making tables. There's a commission that should, Juvenile Justice Reform Act Implementation Commission. It hasn't met since 2012, although it's listed as active on its website. In 2018, Flick fought to get a seat on it. I have been running around trying to get them to meet, but no one knew, there was no one that in the legislature that could tell who should start it between the House and the Senate. So we're finally 2 years later. Flick just got appointed to be vice chair so that we can make sure it continues to meet. Hopefully we'll have our first meeting in January 5th.
That's terrific. Gina, can I interrupt so that I can send it to Kristian for a second?
Yeah, definitely.
Thank you so much. Yeah, it's okay. So we're getting a lot of questions in, and I hope that you'll keep sending your questions in, everyone. We're only going to be here for about 15 more minutes. Please send the question into the Q&A box, not the chat box. It's a lot easier for me as sort of the moderator/host. I'm really curious, Kristian, because you've done a lot to organize families and youth in St. Louis. And how is it that you face those challenges at a time like this to bring people together at a time that we're supposed to be physically apart from each other? And how is it that engaging youth, because we want to have them have a voice, a seat at the table, why is that so essential?
Yeah, that's a difficult question because this pandemic is real and we want people to be safe. And as much as we're saying, we have to, and it's funny though, many of us who are the ones that's fighting for all of this stuff are the ones that's trying to be the most safe during this time. But a lot of this requires in-person activity and action. And oftentimes there has to be a response in person to many of these entities and individuals. So it's just been a lot of just seeing what families and youth need that are impacted. Like sometimes it's been something just as simple as, I haven't been able to talk to my child. Like, what do we need to do there? A lot of that to, having the actions that we have and having some parents come and be able to be the ones to speak, making sure that those that are impacted are the voices that community is hearing the most. It's not me. It's parents, it's guardians, it's impacted youth. So that, because a lot of times when we organize, and I know all of you have probably experienced it, a lot of times folks like to think that we're giving, intentionally trying to give some type of shock value, or trying to exaggerate truths around things that are happening. So for folks to be able to actually put faces to these issues, to the things that's going on, a lot of times, not all the time, but a lot of the times, it really does cause people to move more into action, if nothing but to at least listen and to care, and to see how they can go from there. So it's really just been continuous contact with families and youth that are impacted, however we're able to, through whether it be virtually, most of it is virtual, but being able to be in constant contact with them, seeing what they need, seeing what type of resources that they need, for not just, it might not just be for their youth that's incarcerated, it could be for other kids that they have in their families, right? So what else are these families needing to be supported? And really quick, to speak to the last question, I just wanted to piggyback off of what both Gina and Val said as far as the government piece. I just wanted to speak to it very quickly, specifically for here, because our governor, really quick with the raise the age. So Gina spoke to it around all the work that we do, and we have government agencies that come in and try to quickly undo that work. So often we find ourselves pushing for legislation change, pushing for different things to be different for those that have a better quality of life. And we have those in positions of power that reverts that try to hold up that progress. And so, for instance, the governor, just as Raise the Age has passed and is going into implementation at the beginning of the year, our governor in late summer was trying to push through legislation to actually have it so that youth as young as 12 will be going to adult jail. So let me give a quick backstory really quickly, and that's because unfortunately, St. Louis is a city that is very high with gun violence and violence in general. And a lot of that violence has been coming for youth. So it's been a little bit difficult at times into how do you talk to the community and how do you respond to that when you're saying youth don't deserve to be in institutions for these reasons. And then you have parts of the community was like where youth are, committing these different type of crimes. How do you respond to that? So there's been a lot of that work that's been happening too with families that are impacted, youth that are impacted, and how do you work with community that don't necessarily want to have youth in institutions, but unfortunately, we've been conditioned to think that the way that you respond to crime is just to throw people in prison or to have more police, right? And so that's been a lot of the work that's been happening simultaneously as well, that oftentimes can be difficult. But there's work that happens, and there's ways in which we can respond to that and have been responding to that. But really, as far as just to reiterate your question, the point of your question is just really just making sure we stay in constant communication and seeing what families and youth need, and making sure that their voices are centered, and making sure if there's times in which we need to respond in person, we do that safely, as safe as we can. So the times in which we've done that, we also had a big youth march here as well during the summer, where youth led that particular action and that march. There's actually been a few youth actions, but this particular one specifically was around youth and youth being put into institutions and things like that. So hopefully I answered your question.
I think that's wonderful. And, I think that you get to something important, and it's to understand that we're looking for a set of programs, a set of needs that kids and that their families need. One of the positive examples I have in the report is that, for the kids left behind in the facilities in the state of Utah, they've actually provided iPads or phones and hotspots to the families to allow the Zoom connections that we're doing right now. Like I'm able to do this as a middle-class family. Lots of families can't. And the idea of understanding a person, as Brian Stevenson would say, is more than the worst thing that they've ever done. You know, approaching all of their problems, all of their needs, and funding programs that are actually going to help them succeed. And, you know, I got a good question in here. I think we have a funder watching right now, and hopefully many of them. But what are the programs that the funders ought to be putting their money toward? You know, not only your own organizations, which by all means, please send us a check. You'll find the donate button on our website and everyone's website. But Val, when you think of the programs that are underfunded in Virginia, or programs that are better funded than they were when you started doing this work, can you talk a little bit about the alternatives to incarceration? Because we really want to see the kids out of these facilities and have their needs met outside of the juvenile justice system. So could you talk about that a bit, Val?
Absolutely. So, you know, one of the premier programs that unfortunately I've just not seen funding go towards almost at all is in Virginia, and that's the Credible Messenger programs. You know, when we start talking about wanting to see we don't want to see children locked up, we want to see children given opportunities, then why aren't we using more of the credible messengers, folks who have been down the path, who have had the experiences that children are headed towards, who have been on both sides and can now intervene from a place of knowledge, from a place of understanding, and even with that firmer voice that children will listen to because they will have the respect for those who have gone down that path. Why aren't we building out robust, credible messenger programs, lifting the restrictions of some of those credible messengers to go into schools? When we start talking about even removing police officers from school, could you imagine when we start talking about counselors, if we stop talking about book-learned counselors and we begin talking about counselors who have lived experience, and allowing that kind of experience to then be the voice of reason in the communities that have those struggles with, you know, I've heard so many counselors say, you know, I wasn't built for this. I wasn't trained for this. I don't have what it takes to replace that police officer. Then you aren't the counselor that we're talking about. When we start saying replace the police officer with a counselor, we're talking about that individual who has that everything that's necessary to talk to those kids that need that someone who is from their neighborhood, someone who looks just like them, someone who speaks their language, someone who understands the undertones of community and what is the culture of community and how do we merge the learning environment with the community environment until it becomes a seamless transition, that in the community, I'm supported. In the schoolhouse, I'm supported. And what I don't have is a police officer following me around in my community and right into my school building, ready to shuffle me right on into juvenile justice and then right on across the way into adult systems. So that would be my number one. If I were to say anything else, it would be, so, you know, I am going to give a little plug for something that we're doing. We're launching our inaugural Youth Development Academy, but to have programs where young people, they are taught everything that they need to know about advocacy. Every child isn't going to want to be a juvenile justice advocate. So we're making sure that environmental justice advocates are going to talk to our kids. We're making sure that economic justice advocates are going to talk to our kids, but they're going to get 6 months of training. What does it mean to organize around something that you're passionate about? How do you turn that organizing then into a piece of legislation and having, you know, knowing how to go into the General Assembly and fight for that piece of legislation? And then how do you then transition from, okay, so now we got the legislation passed, how do we make sure that that legislation is working in the ways that we intended for it to work in community? So after 6 months of training, our kids are going to get 6 months of internships, paid internships. We believe in paying our children. So fund the paying of young people in whatever organization they're in. If they're in FLIC, you make sure that you fund FLIC so that they can pay those young advocates. When they're with Kristian's organization, you make sure that there are funds so that whenever young folks are coming together and they are sharing their intellectual property, when they're sharing their expertise, there is money to pay those young advocates. We are raising up a generation of the next power players, right? We're raising the legislators. We're raising the EDs and everything else that you can imagine along the continuum of advocacy. And so you start paying them now so that they anticipate that, of course, they're going to pay me for when they go to speak, pay them a stipend for their speaking. So funders, that's what you can do. You can make sure that everyone with the most lived experience is being paid for their expertise, because that's what they are. We have done so much glorifying of book learning that we have forgotten that it's in the streets that you learn those things that are going to help those kids that are from the streets. That's how they're going to learn and find their way. You're going to pay them for what they do have until you're able to give them more of what they don't have yet. And we're also, and at the end of that, we're asking those organizations, thank you for paying, we are supplying that $1,000 a month stipend for these kids, but we're saying, can you create, if you don't already have, an entry-level position for those children? Because we're raising up the next generation, and we're not going to teach them about handouts. We're going to teach them how to be fighters. We're going to teach them how to be legislators. We're going to teach them how to be leaders. So those are the things that I would say.
This is great, Gina. So we only got like 4 minutes left, and I'd like everyone to get a last word in as best as possible. But, someone asked, what can we do? Because it seems like a donation is the easy way out. But what we just heard from Val is like, your $25 given to Rise for Youth or to Flick or any of our organizations really does make a difference. We are not giant funded organizations. But what else can people do to get involved locally? And I think I'd like to leave it there on sort of that hopeful note of someone who's listening to us today and wants to get involved in Montana or Nevada. Just, how do you find organizations like yours, or how do you go about building organizations like yours? And of course, I'm leaving you like 60 seconds.
I know, I was right. I was like, that's a lot.
How is it that people find you? And so how can our listeners find people like yourself in their community? I think that's probably a good place to leave off.
Well, I want to say yes to everything that Val said. And if people really want to help, it's really hard. You kind of have to Google search, right? Because we're always the best kept secret because we are so underfunded and we don't have marketing, budgets per se. So I do want to just add to what Val said, though, because everything she said is so important, but also the reverse. If you have been putting your money in places where you look around and the folks running the organization and working the organization don't look like those people impacted, think twice about that, right? So, and also ask the questions. Ask all those questions Val just asked. What are you doing to really support our young people and their families and those folks that are most impacted? Do you have such a program to raise up, and to develop, to replace yourself with those folks that are most impacted? And if the answer is no, then you might want to rethink that. So, it's not really that hard. We believe that we are the experts on what we, everybody said, the people closest to the problem are closest to the solution. Look for those organizations. Ask people in the community, go to where those people are and ask them those questions if you really want to get involved. This is not neat work. We got to get our hands, we got to get in there and get our hands involved. So you got to go to where the people are, ask the questions, ask who's really helping them, and then support those organizations with your either finances or your body and your hands and bodies.
Kristian, how do you say
that also?
Wonderful. And Kristian, you can leave off however you'd like, but I'd love to hear your answer of how people find you and advice for our listeners of how they'll find the Kristian in their community.
Yeah, first off, Val and Gina, y'all about to have my head fall off from nodding and agreeing so much. But yeah, Gina said, in my mind, it's like, looking for Black-led, Black and brown, like who lives on the margin, like if that's those institutions, organizations that if they're Black-led, who's on the board of these organizations? Who do these organizations get their funding from? That's important as well. Like who sometimes you do literally follow the money because a lot of time that dictates how work happens or doesn't happen. And also like making sure that you're, you know, like as church say, giving your time and talent, right? So, and your treasure. So if you're able to give funding, great. But also if you're able to volunteer to an organization, if you're able to just word of mouth to talk about what an organization is doing to someone that you're in relationship with. So being able to do those things, like how do you support local grassroots organizations? It's great to give nationally, it's great to give to big organizations, but a lot of times they got plenty of money because that's the quick go-to easy way. But you know, it's these local grassroots organizations oftentimes that's so underfunded and does so much work. So and like Gina said, you know, Googling, finding out who's doing work in your respective neighborhood and communities, and find out how you can support them, how you can be a member. A lot of organizations have ways for you to become a member of an organization. They have ways that you can donate, you know, annually, monthly, however. So being able to do those things, I think, is important as far as being able to connect to organizations locally. But the most important thing, and it's been said and I'll say it again, is just making sure that these organizations are being run and funded by those that look like you, by those that are the youth in the communities that are impacted the most. And these are communities of people in color, specifically Black communities. And real quick, because I saw somebody ask about like all of this being impacted predominantly with people of color and youth of color. And absolutely, like you mentioned this facility and those youth in that facility, and this is also in a community that is predominantly Black community. So again, you know, you continuously see the perpetuation of the lack of support, resources, and care for for our kids that look like us, our kids. So I think it's important if folks really are for real about how they want to help, how they want to be supportive, what work can they do? Like that is how you do it. You support grassroots, local, predominantly Black led, or at least Black staffed organizations. I don't want to get deeper into the weeds of that, but that's very important. As someone that has worked with Black led institutions and have worked with non-Black or non-people of color led institutions, and the tone sometimes that can be starkly different, and not because it's on purpose, but because if you don't know, you don't know. You don't have that lived experience. You don't know how communities are impacted because you're not in from that community and, you know, ingrained in that community. So that's what else I'll offer. I feel like the mic could have been dropped earlier from these two, but yeah, I'll just add that.
You know, I think this was wonderful. We're going to wrap up here. We promised that we'd keep you an hour, and it's been an hour. You know, the title of our day today was Youth Justice in the COVID-19 Era, but there's lessons to be learned that go beyond what happened and what is happening now in our communities. And I'm really trying to lift up voices here about making sure that everyone has a seat at the table, making sure that that youth are heard, that we're not relying on incarceration to meet kids' needs. And I really think that our panelists did a remarkable job. I knew that they would, which is why I invited them to speak of their own experiences. You, I think, have our email addresses. Don't hesitate to continue to pester us with your questions. We really got flooded with the Q&A, which is awesome. But if you didn't get your question answered, I'm sorry. It's really just because of a wonderful conversation that took place. So thank you again for all of our panelists. Thank you, and keep fighting.